remove it without scar. What's it? Someone said hello. Oh, glasses on. Okay, Maddie is a cat has said hello. How are you doing, Maddie is a cat? I'm okay. How often do you say, oh, here we go, Sassy Amore, number one. How often would you, oh, we've got the headmaster's hair team. Oh, hi, Katie. Oh, Liz. Hi, Liz. It's amazing what happens when you put your glasses on. How, please ignore my, oh, just Maddie. Okay. Sorry, how often you say breast implants need changing? I've done the birthmark mold, yeah. So, well, a lot of people say they've got to be changed every 10 years. I don't subscribe to that. And sometimes people come and say, oh, my breast implants have been changed 10 years. I need to get new ones. I'm like, well, what's the problem? So I basically go on symptoms. So if you've got no symptoms, I personally, and surgeons are different. You know, I think some people, I think they would sort of say you've got to change them every 10 years and would change them every 10 years. The problem with doing that, there's potential complications and issues with having surgery, obviously. So I would not advise having surgery unless you had to, sort of thing. So I would say to you that if you haven't got a problem, you don't need to have the implants changed. A lot of the implants, all the implants we use at the clinic are guaranteed for life. So the implant themselves is guaranteed for life. So they're not built to need to be changed. Having said that, you often do need to change them. So I'm not saying they're going to last forever, but you often do need to change them. And the reason that you might need to change them, the most common reason that you would need to change them sort of long term, is capsular contracture, scar tissue forming around the implant, making the implant go hard. So if you have a hard implant, you might want to have it changed. That's, as I said, the most common reason for having an implant changed. If you haven't got a hard implant, then you don't have to have it changed. Rupture is another reason, but I don't personally scan for ruptures. I don't go looking for ruptures. Some people will kind of routinely scan patients for ruptures because, for a couple of reasons. If you're asymptomatic, I'm like, I don't want to cause you problems. And sometimes the scans have said that they're ruptured and they're not, and sometimes the scans say they're not and they are. So that's something to be aware of. So if you're having surgery just because a scan said it's ruptured, you can say, well, it probably is ruptured. The scans are pretty accurate, but there is a small chance that they are not ruptured, and vice versa. The scan might say it isn't ruptured and there's a small chance that it is ruptured. So it can kind of create more angst than it actually cures. So if you're asymptomatic, I personally don't do anything except go on your symptoms. So if you've got no symptoms, then you don't need to have anything done. And oh god, I think it says here, did it say, did it put, oh yeah, minor polyurethane, had them 11 years. So polyurethane, one of the best things about polyurethane is that they've got a much lower rate of capsular contracture than silicone implants. Polyurethane implants are even less likely, got a good setup here, very professional setup here, I think you'll agree. Polyurethane implants have got a really low risk of going hard, 1% at 15 years, 1 in 100 at 15 years. So that's the great thing about polyurethane implants. And so yeah, if they haven't got any problems, I would say you don't have to have them changed. Obviously talk to your original surgeon, all that sort of stuff, but in my practice I don't recommend patients have them changed routinely. I only change them if there is a problem, and the most common problem would be hardening. And polyurethane implants, the beauty of them is they're much less likely to go hard. So if they're not hard, you've got no problems, I offer people follow-ups with me to keep on the books sort of thing. But if you haven't got any problems, you can just see what happens, and you might get a capsular contracture. So it's not 0%. There is a chance you could get a capsular contracture, and if and when that occurs, then you might look at having them changed. But that's my view on changing implants. And I do know that some surgeons say that you've got to have them changed every 10 years, but I'm not sure where they got that from, to be honest. A lot of people in the world seem to say that. People come to clinics, they've got to be changed every 10 years. I'm like, where'd you get that from? Where's that come from? Where's the 10-year change thing? Where's that? Who said that? Did the implant company say that? No one told me that, you know. So yeah, that's my take on it. So yeah, so they're fab. So yeah, stay That's it then, Sassy. Keep going. Keep going. Well done. I like polyurethane implants for this reason, that they don't go hard. Well done, you. It's good news. So, can you remove an infected cyst? Can you, or would you? So there's a lot of things you can do, but I wouldn't, basically. So I wouldn't remove an infected cyst personally. So it's quite common for people to have cysts for many years. They get infected, they get red, they get angry, they get painful. They ring us up and say, "Oh my God, quick, love, you've got to get me in. It's all painful, it's angry, all this stuff's coming out, it's all horrible." And actually, we'll be like, "Well, no, we're not going to do it now. We want to do it when it's quiet. We want to do it when there's no problems." Because if we do it to get a cyst out, you have to make a cut in the skin and get that cyst wall out. And there's all sorts of reasons you don't do it when it's infected. Number one reason, the surgery is horrible. Local anesthetic never really works very well in an infected area. It's all mushy. It's very hard to tell where the cyst wall is. It's just horrible doing surgery in the presence of infection. And when we close up the skin, there's a very high likelihood that wound's going to get infected if there's kind of infection in the area. So it's not good to do surgery on an infected cyst. So what we'd say is, if you're infected, get the infection sorted out. You might need some antibiotics. Sometimes you might need to have it incised, drain. Again, that tends not to be us. That'd be more like a general surgeon or a different type of surgeon who might kind of help you with the if it forms an abscess, and then they have to let out the evil humors. And that there are things that might need to be done for an infected cyst to get over the infection. Once you got over the infection, then you can look at doing something about it in terms of removing it. So we would want to see you a few months later, once the infection's over, and then when it's all quiet, when it's all died down and there's just like a cyst there, then we would talk about removing it. So it sounds bad, but we're not very helpful when people ring with an infected cyst. Kind of want to be helpful, but there's not a lot we can do really with infected cysts. It's like we can't do anything about it. You need to sort out the infection, which might need antibiotics, might need sort of lancing or opening up. Might not need anything. It might sit on its own. I don't know, but it's not really. We don't really get involved when there's when there's open or overt infection. There we wait for it to settle down. So and actually, once it's been infected, it's a little bit more difficult to do the surgery later because there's kind of scar tissue around it. So it's a bit more difficult to tell where the cyst wall is, because when you do the surgery, you want to try and get rid of that cyst wall. And if you can't really tell where the edges of the cyst wall are, you're a bit more likely to potentially leave some behind, and it can recur. So ideally, you would remove a cyst which had never had any infection, but that's an ideal world. If you've got an infection, you have to wait for it to settle, and then we can do it. You might be able to get it out nicely, but it's a little bit more difficult.